Hello and good morning. My name is Nerissa Recinos, and this is my presentation in this course for the final presentation over the Affordable Care Act. Thank you for joining me. Here are my table of contents. To begin, I wanted to discuss by introducing what this will be about and what I hope to achieve. Through this presentation, I wanted to discuss the multitude of different successes that the ACA has brought to many Americans over the past, decade, about 12, 13 years now since its enactment in March 2010. Um, for many Americans, we hope that the ACA is only just a stepping stone, a stepping stone into more future plans of more diverse and more in-depth healthcare reform in our nation. I first want to begin with discussing too the history of the ACA. I want to call it. It was a very rough. It's been a very rough 10-year battle, but even prior to that, I'd say it was a very rough, almost 75-year battle to even have any sort of breakthrough for any sort of healthcare reform at all in our nation, which it should not have taken that long, but I digress. The ACA was a momentous event that occurred in our nation. There's a lot of effort for it to be developed and put into place. It was honestly first proposed by Barack Obama as, in his words, a large middle class tax cut that soon became the key aspect of his presidential campaign in general back in 2008. That's really too when there was another major fight for healthcare reform. As I said previously, the fight for healthcare reform has been a debate for the past 70 years or so. And this was finally a step forward as the ACA was finally enacted and passed on March 23rd, 2010. Through that, the Patient Protection Plan slash program and the Affordable Care Act of 2010, more commonly known as the ACA, is intended to expand access to health insurance coverage primarily for those who fall through the cracks of the private and public insurance mechanisms in the United States. There was a lot of earlier efforts that first tried to take initiative in regards to healthcare reform, such as the Clinton Plan and even the Romney Care Health Plan, but that didn't see as much success as Obamacare, or better known as the ACA as well. The earlier efforts into the Obama campaign really solidified, too, how the Republican Party continuously tried and still do try to dismantle any efforts towards Obamacare slash the ACA. The ACA is something that is unfortunately so politically intertwined, which is why it's still so harshly debated in the House. That's why there was a lot of countless effort and time through legislation, drafting, considerable work in the House and Senate for this act to even be considered in the first place. More so, too, delving into, as I said previously, it's a very, very politically intertwined subject. As previously stated, the concept of healthcare reform is not a new concept, especially by the Democratic Party, as it was fought for by many previous generations. That's why the breakthrough of it being signed into action by President Barack Obama in 2010, which relieved many Americans, and allowed them to have insurance coverage that was mandated, and there was many other major provisions that came along with it, as we are seeing and will be discussing, that has happened in the past decade. It was and still is a highly debated and vigorously fought against bill between both the Democratic and Republican parties once again. That's why the final hurdle for it to even, when it was first enacted and it to be really solidified, was back in 2012, when the final hurdle um, was cleared in 2012 of June when the Supreme Court upheld most provisions of the healthcare law and the Healthcare Act itself for in regards to the ACA. Because it's also widely known as Obamacare, which is why it is still so politically challenged. Uh, that is why also the Supreme Court has still ruled that states are not forced to cooperate with the Medicaid expansion it comes along with. However, most of the other provisions are still intact across the country. That is really the only thing that's not forced um, following the passing and mandate of it. When we discuss the major successes, and especially the key successes that we have seen in the past decade in regards to the ACA, ever since the ACA was enacted, there have been a lot of helpful provisions to millions of Americans to better their overall access to healthcare. Some of the key aspects that the ACA has provided in the form of services over the past decade span in many different avenues. From this source here, a lot of the success points regarding the enactment of the ACA showcase more care services geared towards women, which is great, especially in forms of like preventative care services for the health of women and families, being introduced to better pregnancy assistance services, better maternal care, and even more better private insurance coverage for women overall. Even further into it, there's also been a lot of better protection services introduced for people with disabilities. Um, there are a range of services for the general population that has been offered, such as better payment plans, bundled payment plans, and even more extended protection against people with disabilities, and better access to mental health support services, along with substance abuse support services, which is great. When we too continue to talk about the access and the better access for Americans in general since the excuse me enactment of the ACA, I believe one of the key points that the ACA has accomplished is helping bring more access to those seeking specialty care, primary care, and more timely centered care overall. Um, it has brought better access to primary care doctors and physicians. It's brought a lot of attention to primary care, which is great. It's also brought better access to Medicaid and its services due to the expansion in some states. It has brought better access to those seeking prescriptions, better access to maternity care, behavioral health needs, and other essential health benefits. It has also helped improve access to more utilized care, such as major procedures like surgeries, more substance abuse services, support services, mental health disorder services, and even helped improve admission rates in hospitals. I believe, too, when we discuss the ACA, we really need to talk about more so of the different coverages it offers, more so, and usually following to different insurance coverages that it now offers or helps better. The ACA has done a lot in terms of coverage and overall how much it has improved insurance coverage, particularly for many people. It's been very innovative in its overall approaches to reducing costs in many ways for those that are insured under coverages, the major coverages such as Medicaid and Medicare. Um, it has brought forth new enrollment plans for these coverages that has helped reduce the number of Americans who were uninsured with any type of insurance previously. Um, and also, I think it's important too to highlight the way the ACA has encouraged more substantial ways that people can enroll for these benefits or better options, such as enrolling for insurance exchanges in regards to offering better tax credits. Two, also, it has brought forth new forms of coverage by broadening the access in different forms, such as more employee-based and employee-sponsored coverages as well, which I think is great. It's also very important to discuss the ACA, since the enactment, it affects, I think, a lot. Not I think, it does affect a lot of different healthcare organizations, but in particularly, um, it affects really one a lot in general. As I stated here, there are a lot of healthcare organizations that are involved with the ACA and have to follow their protocols and guidelines since its enactment. There are a lot of policies, protocols, and ethical guidelines that have to be followed since the passing. And the main organization involved in the middle of it, all of it, are hospitals. Hospitals are the main source of profit in the healthcare field. They make the most money, and they also can lose the most money, because they cost so much to maintain, and that's why financial revenue is so important, for these organizations. As with this source here, the ACA has established many initiatives supporting unnecessary hospital admissions for focusing more so on primary care. Due to this, it has presented a lot of challenges to these hospitals. It's done a lot in putting financial decline in these hospitals, as well as due to insurance coverages as well, since they're strongly intertwined with health hospitals as well. That's why we need to discuss too how these hospitals are impacted in regards to the ACA and their overall protocol. The main issue that has taken place in these hospitals since the passing of the ACA is the financial profit that is involved. Hospitals are tightly intertwined with different coverages such as Blue Cross Blue Shield and other smaller plans that fall under that usually. I mention this because hospitals have to legally abide by the patient protection program that have established roots within Medicare and Medicaid. And ever since the enactment, it has caused ripple effects across several hospitals and has set them up time and time again for quite the monetary loss, or more so, major financial cuts due to the ACA requirements that have shifted to more primary-based care and people shifting more to seek out their primary care physician than seeking out a hospital. Hospitals as well have become the ones in a lot of cases to compensate patient care due to the ACA new exchange policies in regards to self-pay requirements and requiring Medicaid to have these hospitals compensate in place of their coverage. That's why there are a lot of financial losses to be happening in these cases. I believe it's important as well that we look at this at the more clinical level and see what the ACA has done to improve at the more clinical level. It is no lie that there have been improvements at the clinical level of the ACA enactment, specifically when we begin discussing the change in delivery of healthcare and the aid to more access to a wider group of people. With this quote here, there has been impact in regards to more bundled payment plans and better delivery and quality of care overall. Also at the more clinical level, there have been more issues, however, which is, I think, a great point to always highlight. There will be negatives to this. There have been issues in regards to the patient relationship between prices and costs. There has been a significant lack of holding providers accountable for the cost and the quality of care that they provide. There have been a lot of effort from the ACA in regards to helping these physicians to garner better profit for themselves, but there still is gaps. There's still gaps and cracks for these certain patients to fall through. I say this because I believe there needs to be better incentive for these providers, something that holds them more accountable in the care that they deliver and that they are providing the best quality care possible. Because clinically, care should not be lacking anywhere. There should be no gaps to helping patients at that level. To talk more about the different coverages and services that the ACA has offered over the past decade, even looking at the stats by 2016, after 6 years, the number of people finally having some type of insurance coverage has risen significantly since before the enactment. It's really helped provide new services in regards to Medicaid enrollment, new coverage gains through Medicaid, and new eligibility forms for Medicaid as well. This quote here: there has been greater diverse health services with more access to specialty care services and better access to those who are low income. Those who are low income now have access, or most that are low income, let me rephrase that, now have more access to prescription drugs if they are enrolled in Medicaid as an enrollee. Once again, because not all states have accepted the expansion. There's a lot more financial protection in regards to also decreasing out-of-pocket costs among these enrollees. However, though, discussing the ACA, it's important to highlight that there are still those that will fall behind. That's why this should not be the final form of healthcare reform. A key point of information to highlight has been the introductions to more accessible coverage, but even so, there are still disparities within that need to be discussed and pointed out. Even with new insurance expansions, there are still those that fall between the cracks. The entire need for reform in general is because of how unequal healthcare access is and still is in the United States. That's why there are key disparities, are those, unfortunately, it's usually within race, as it can unfortunately pertain to those who aren't insured and who isn't insured by any type of coverage. The new ACA expansions also have raised new forms of barriers, unfortunately, for those that have already fell into those minority and uninsured categories. There is also, when this happens, it's good to point out the insurance gap in regards to coverage that needs to be discussed. A huge chunk of those uninsured are still the Hispanic population, and that's where the gap comes in, which needs to close. Because these barriers are still prominent, and the ACA does still fail to address this part of the population properly. That is why, too, when we look at this at a more clinical level, with all the level of breakthroughs that the ACA has had, there has been a lot accomplished with it, and there's still a lot that is lacking. Patient experience at the clinical level has improved experience, out-of-pocket expenditures, and brought more aid to those who are low income. However, the issue lies within quality of care, the utilization of care, and the total cost still. Because even with the ACA, there are still those that are low income that still fall behind and are susceptible to falling in those gaps and more likely to come across and have low value care because of that. There's still a lot of impacts the ACA has in regards to Medicaid expansion. Different treatment intensities have enhanced over time as the ACA's further participation in Medicaid and its overall expansion. These barriers are being crossed, and is more of an importance of having a primary care doctor is realized. As I said previously before, the ACA has done a lot to aid healthcare reform, as it has been a debate that's been happening for over 75 years. It was a big stepping stone. It's done a lot financially, more so than anything else, as a lot of the times the ACA covers 100% of the cost covered for essential benefits and providing a health insurance market as well for every state now, which is great. Because also it's still important to realize that unfortunately true reform might never be realized between the two major political parties, since it is still such a big debate. It's a big playing chip in political campaigns, which is important to emphasize and realize as well. The overall point of healthcare reform is making it available to everyone that seeks medical care. The ACA has made it where health plans and health insurance coverages are no longer able to deny people with pre-existing conditions, for example, people that have diabetes. It's an enacted change in regards to making health plans more easier to understand. Communication is no longer a barrier. People should be able to understand what their plans and coverages consist of. And it has also helped make healthcare more accessible due to the amendment passed in regards to offering coverage completely covered without a copay. Financially, that is and still a huge achievement and a huge step forward. Finally, it's good to realize and good to surmise where we go from here. The ACA should have only been seen as a stepping stone to bigger plans of healthcare reform in this country, such as universal healthcare coverage. We are the only developed nation that is still really struggling this hard for providing proper and accessible healthcare to its population. However, with how politically intertwined it is, I fear the debate and battle for true healthcare reform might never be realized, and it might continue to last over another 75 years, unfortunately. Thank you for watching and listening to my presentation. I appreciate it. And thank you again.